I'm truly honored to be here and speaking to you about one of my favorite subjects, which is chiropractic and how we can achieve health through chiropractic. I have a lot to share, and I want to try to speak a little bit too fast so I can get all the things that I want to cover. Technology affects lifestyle, and we've talked about that a lot these last few days. And the lifestyle impact has an impact on our bodies. So these impacts would lead to some misalignments, and we're going to be talking about those. What are misalignments and what causes those misalignments? And then I'll be talking a little bit about what is chiropractic, and then my favorite subject, which is directional non-force technique, and that's a technique I've been using over 28 years. And then I'd like to talk a little bit about how we can take care of our bodies, our physical bodies, which would affect our body and mind and the spirit. They're all connected, and when we have a good physical body, our mental and spiritual would be in a better place. So technology has tremendously improved our lives. We know that. And people connect easier, and the world is a smaller place. And then when we talk about the medicine, the advanced diagnostic and treatment methods are certainly saving lives. But what's missing is the lack of human touch. And that's, when we talk about health, human touch is very important, and my other colleagues, they have talked about that also. So when we get to the lifestyle, what we do during the day, every day, what kind of effect these technology has on our bodies. And then, we talk about women that are multitaskers, and we do a lot of things. So all of these creates the fast pace in our lives and makes us to want to be in this position of fight or flight response all the time. Even when we are doing simple tasks like washing dishes, and we are having our shoulders tight and our bodies are tense, thinking about all the other things that we need to be doing. So that creates a lot of tension in our bodies. And having longer working hours because of electricity and not having enough resting time would all affect and cause some problems with our musculoskeletal system. Then doing the same kind of movement, the hours of doing the same kind of things, sitting in a same position all the time, all of these would have some effect on our bodies. And that's what I want to talk about. That what would it lead to is that there would be some kind of imbalance in our bodies. So the muscles in some part are not using, they're working a lot, and some parts are not working properly. So that causes some structures to go out of alignment. So any kind of stress, physical or emotional stress, can cause our bodies to go out of alignment. So as I said, doing the same thing, we are creatures of habit, so we do the same kind of things all the time. I stand the same way, I walk the same way, I carry myself the same way, and that causes imbalance in our bodies. So having these misalignments can lead to having dis-ease. So we cannot be healthy. Our health would be diminished. So misalignments these misalignments cause nerve interference. When they go out of alignment, they put pressure on the nerve and interfere with those normal nerve impulses. So the body cannot function properly. So these are called subluxations. And in chiropractic, what we do is that we analyze and correct these subluxations. So the proper alignment to these, when we have this proper alignment, the body is in better health. So would it be nice if we had the technology to know what structure is out? We could ask the body what is out of alignment, in what direction it's out of alignment, in what sequence do we need to correct those structures. So in DNFT, this is exactly what we do. And this is what I am very excited about, that we have the technology to ask the body what is out of alignment and what is not out of alignment. In what sequence do we need to correct that? So directional non-force technique is the grandfather of the low-force technique in chiropractic, and it's been around over 80 years. Dr. Van Ramp is the developer of this technique, and he came up with a leg check and a system of challenging to find what is out of alignment. And it took him about 12 years to come up with a way of moving the feet to get to the leg check that we do. So the basic of diagnostic method that we use is the challenge. We challenge a structure, and then we do a leg check. I challenge a structure in a direction, and then I know if that structure has moved into that direction, and then I can check it with the leg check. So to correct that, I use a very light touch. It's a thumb thrust to correct that, and I also use a disc, is a flexor to correct the discs. So this type of work is a very specific detailed work that I do, that I find that subluxation that I was talking about. I find the vertebra, the rib, the disc, the ligaments, and all the muscles that are attached to that area. I can check, I can exactly know what direction it's out of alignment and correct it. Then I have a method of finding the cranial adjustments. We work on the cranials and the jaw, the temporomandibular joint, and the facial bones. Then we have a comprehensive shoulder adjustments. I can work on the muscles in the shoulders, and as you can see in the diagram, it's a very detailed. I can check all the structures that are related to the shoulder and find which one is out, in what direction it's out, and then correct that. Then we do I have ways of finding the soft tissues, the organs. If there is any tension with the organs, I can check the bladder, the large intestines, or the female systems, and see if there's any stress in those organs. And then we have an exclusive, I can specifically find what disc is out of alignment and correct that disc and get great results. So then I also check the cervicals, very specific detailed work on correcting the cervical areas. And notice that I can do all of these without the use of x-rays. And then we can check the knees and see what knees are, if the knees are out of alignment, and correct those. So then the advantages of DNFT is that the diagnostic procedure, and we utilize that inborn wisdom, the innate intelligence in the body. I can ask that and say what structure is out, in what direction is out of alignment, and I don't need to use the x-rays. Also, I can use this technique on any kind of conditions, like disc herniations or vascular problems or osteoporosis. Age is not a problem, or significant strain or sprains. I can take care of those also. And the results are very fast and very consistent, and we don't have to have a lot of visits to get to this response. And the patient continues to feel better after the initial series are done. So when a patient is properly aligned, it helps them to be more aware of their bodies. And that's what I wanted to talk about, so that we do the same thing all day. We're sitting, working. So when we become aware of our physical bodies, our body positioning, we need to be aware of them so that we can change it. We become aware, okay, I've been sitting like this for a while, I need to change it. So when I think about that, it brings me back to the present moment, and that's what we talk about in here. So we are reminded to be in the present moment and take a deep breath, and when we do that, it helps us to feel good about ourselves because we're doing something good about ourselves, and it also helps us to prevent the musculoskeletal problems. So just a practical tip so that we can take care of ourselves better is that when we are sitting anywhere, whatever that we are doing, we can simply take a deep breath and shift our position. So when we do that, we are doing something different, just to the opposite. We check and see, okay, I've been sitting like that, I sit the other way, and then we are creatures of habit, so we can recognize our habits and what we are doing so that we can change them and feel good about ourselves. So thank you very much for listening.